You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so like patients or healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So it can be a medication, it could be a chemical that we work with, it could be a vaccine, and believe it or not, it could actually be related to the weather. And that's what we're going to be talking about today. We're going to be talking about disaster and how you, as someone who is pregnant or breastfeeding, can prepare. Taylor Dubuisson is the coordinator of training and best practices for the Disaster Distress Helpline, one of MotherToBaby's new partners. She is also a mother of two toddlers and has spent the last 15 years living in hurricane-prone areas, including South Florida, Guam, and now coastal Mississippi. So she knows a lot about our topic today, and we are so grateful to have her on the show. Taylor, welcome.
Thank you so much, Chris. I'm happy to be here.
So the burning question on my mind right now is, how is the weather where you are?
It is hot. I know a lot of the U.S. is experiencing this heat wave that is making its way from the Midwest to the Northeast, and now it's moving south. So it is hot. It is humid. It's great. Love it.
As someone who's been living in Arizona for the last 9 years, I can relate in a slightly different way, but the word is the same, H-O-T. It is hot out there. What is the Disaster Distress Helpline?
Yeah, the Disaster Distress Helpline is a 24/7, year-round, multilingual crisis counseling and emotional support resource for survivors, responders, really anyone in the U.S. and territories that are struggling with distress or other mental health concerns related to any natural or human-caused disasters. So people can call or text 1-800-985-5990, and they're answered by trained counselors from our network of independently operated crisis centers located across the country. The DDH operates 2 online peer support communities as well for survivors and responders of the COVID-19 pandemic and survivors of mass violence. And we have a website called Strength After that encourages survivors to share stories of hope and recovery. So the DDH is administered by Vibrant Emotional Health, which is a New York-based nonprofit, and it's funded through the Substance Abuse and Mental Health Services Administration.
That sounds like a lot of excellent resources. I want to highlight again, multilingual. Love that. Don't hear that all the time. And just so our audience knows, certainly feel free to rewind, but we will have all the information about DDH in our show notes. So Taylor, why should we be talking about hurricane preparedness, especially for people who are pregnant and breastfeeding?
Hurricane preparedness is so important for everyone, especially right now with how hurricane season is predicted to be very active this year. We've already seen a lot of active disaster seasons with tornadoes and heat waves going on. So hurricane season is a really important time for pregnant and breastfeeding people to be prepared, because there's extra precautions and preparations that they need to make. especially if there's pregnancy-related complications, if they have special dietary needs. It's best to prepare early and to over-prepare so that you're not stressed and struggling as the storm is on its way.
It's such a great reminder to be prepared because, when you're pregnant or breastfeeding, and really just in everyday life, there's already so much going on. And if something comes and takes you by surprise, it could knock you right off kilter. So we know that you have experience living in hurricane-prone areas during pregnancy. So again, you are more than the perfect person to talk with this about. Can you share your experience with us?
Absolutely. I lived in Guam while pregnant with both of my daughters, and they're now almost 4, and my youngest is 2. So it was more stressful with my older daughter because Guam's typhoon season, which is very similar to hurricanes, typically runs from June to December, and I was due in September, so right in the middle of season.
Wow.
I had to be aware of our hospital protocols because if you get super close to your due date and a storm comes in, you have to shelter at the hospital. So I had to be aware of that as well as emergency procedures because with Guam being a small island in the middle of the Pacific Ocean, evacuation isn't really an option. Mm-hmm. So we had to be as prepared as possible to weather the storm in our home or potentially at the hospital. And we were lucky that no major storms hit during either of my pregnancies, but in our last year in Guam, while my girls were, I want to say, almost 3 and the youngest was 1, Typhoon Mawar hit, and it was a super typhoon. And it was very stressful, but we really relied on our emotional support, and it was so important that we had this because I had people I could talk to when I was stressed, and they empathized with what we were going through. I had friends that were pregnant or who had young children as well, and we were sharing resources like water and food, and they offered to let me do laundry or let my babies hang out in their AC because we were without power for 2 weeks in the middle of summer.
Wow.
And that was hard. So having that emotional support, I think, is one of the biggest things because even though we knew the situation was hard and it was uncomfortable, we had support and we knew we would get through it.
I'm so glad to hear that you've had a support system, folks, that you said, that emotional piece, but also some of the little things like, just let the kids hang out here, let them stop, sweating for a few minutes. And that's excellent. What can people who are pregnant or breastfeeding do if they know that a hurricane is on its way to their area?
That's a great question. It's definitely important to discuss your plans with your healthcare provider to determine what is safest for your situation and find out information about any hospital shelters, such as where they should go, what you should bring, and get emergency contact information. It's also great to have a copy of your medical records, prescriptions, and important phone numbers in a dry, easy-to-access container. Because while it's great to have pictures of these things on your phone or having files, you don't want to be left without them if your phone dies or breaks. Mm-hmm. Your hurricane kit should also be stored in a portable airtight container if possible so that you can take it with you if you do evacuate. And I recommend, from my experience, having enough supplies for yourself and your baby, including water and medications, for at least a week. For us, we were without power for 2 weeks when the storm hit in Guam, and luckily some of the stores had opened back up, but it was still really hard to get essentials. Another thing is with the high temperatures forecasted throughout the summer, it's important to make sure you have a way to keep cool during power outages with fans, water for cool washcloths, and again, keeping yourself and your baby cool.
Can you tell us more about a hurricane kit?
Yeah, so that is just having all of your supplies together. We use a tote and we include the food that we're going to need, having non-perishable items like protein bars and canned goods. We have a camp stove so that we are able to heat some things like soups, and having enough water. So I believe the recommendation is at least 1 gallon of water per person per day. And for pregnant and breastfeeding women, you want to make sure you have that, if not more, to stay hydrated. And if you're breastfeeding but pumping, you'll need to be able to wash pump parts in case there's a boil water notice. So there's so many great resources like ready.gov that put out lists for what you should include as a minimum in your kit. But it's really what makes sense for you and your family to meet the needs that you're going to have if a storm hits.
I really appreciate the emphasis on water. And as Taylor said, lots of great resources on how to build your own disaster kit, which will be in our show notes. But the water thing is especially good universally. So you don't need to have a hurricane like where I am, for example. Temperatures are in the triple digits. And supplies are a little bit different now in a kind of post-COVID world. And bottled water is usually the first thing to go. So again, Taylor, your point of preparing, of thinking ahead and trying to the best of your ability. You know, there's a lot going on, but trying to make sure you have these things in place. So if you do need them, you have them on hand. Okay. What about after a hurricane? What are some of the things that people should be thinking about?
Okay, yeah, that's a great question. When there's been damage, there's a lot of things people should consider, such as preventing any strain or injury for pregnant and breastfeeding people. They should also pay close attention to local notices for things like boil water advisories or damages in the area that may affect the environment. And it's also important, again, with this extreme heat that's happening, to take the precautions to prevent dehydration and exhaustion and eat as healthy a diet as possible. For breastfeeding people who have a milk supply stored, they should also take precautions to keep the milk stored correctly and follow evidence-based guidelines to ensure that the supply is still safe for consumption if it starts to thaw.
Again, an excellent thing, right? Because, you know, we were always taught if your power goes off, keep your refrigerator closed. But then, you know, there's after a certain amount of time where the food and drinks in the refrigerator, even if it was completely closed, might not be safe for consumption, as you said. So try, again, to the best of your ability to know when you lose power. And if you have a rough estimate of how long your power has been off, then you can assess whether what's in your fridge is good to go or maybe not so much. So Taylor, again, a lot of great information. Thank you for being with us today. But before you go, is there a final thought you would like to leave our audience with?
Absolutely. I think when it comes to hurricane preparedness and really any disaster preparedness, using evidence-based sources is key. It can be helpful to monitor media, but using those evidence-based sources that provide information on preparedness and recovery are so helpful. So MotherToBaby is absolutely an amazing resource for pregnant and breastfeeding people with questions. But you can also pay attention to what state emergency management agencies are putting out as far as your area, what to expect, where disaster recovery centers may be located, and also listen to what your medical providers are saying. And when they say start preparing, it's best not to wait. So if you are in hurricane-prone areas and haven't started your hurricane kit, now would be a great time to get one together. And websites like SAMHSA, the CDC, the American Red Cross, and Ready.gov are just a few resources that put out amazing preparedness and recovery resources. And they do have materials that are specific to pregnancy for preparations. And of course, the Disaster Distress Helpline is also available for anyone experiencing emotional distress before, during, or after a hurricane or other natural or human-caused disasters.
Thank you. I wanted to emphasize that too, that, you know, absolutely call DDH after or before a hurricane, but they don't do just hurricanes, disaster. So if you are in need of these resources, it's a good idea to get familiar with them now. Again, we're going to have them in our show notes. And, you know, feel free to contact these agencies and ask questions. This is what these groups are here for. This is what we're doing. And as you said, Taylor, you know, MotherToBaby does have some resources. For example, we have a fact sheet on breastfeeding after a national disaster, which actually shares a lot of the points that you made with us today. So once again, thank you so much for being here. We were very, very grateful to have you on the show today, and I wish you the coolest summer possible.
Thank you, and to you as well. It's definitely going to be a hot one, unfortunately. But yeah.
It sure is. It sure is. But hopefully we're able to stay as safe as possible. Mm-hmm. Thanks,
Absolutely.
Taylor.
Thanks, Chris.
And that's going to do it for this episode of the MotherToBaby podcast. Be sure to hit that subscribe button so that way you never miss a new episode, and you can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. And if you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contactus@mothertobaby.org. And MotherToBaby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the MotherToBaby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Visit mothertobaby.org/donate today. Until next time, remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.